Hello and welcome to my channel. In this lecture we'll continue to talk about the anatomy of the tooth. So let's begin. After discussing the structure of the tooth, the function of the teeth, and the development of individual tooth, now it's time to look at the abnormalities that may affect the teeth. They are either the environmental abnormalities, means due to environmental factors, or developmental that happens during development. Now, the environmental during development, they destroy the tooth structure after development and discolor the teeth at any stage of development, or there will be alteration, for example, to the course of tooth eruption. According to developmental factors, is the abnormalities most commonly affect the number, the size, the shape, and the structure of the teeth. Now, the environmental factors category. You must put in mind that the enamel and dentin do not regenerate, and the developments, the abnormalities that occur due to environmental factors during tooth development have long-lasting effects due to that fact. Enamel hypoplasia is a condition in which the amount of enamel formed is inadequate. This results in pits and grooves in areas of the tooth, or in a widespread absence of the enamel. The enamel affected has a different translucency than the rest of the tooth, and there will be demarcated opacities of enamel that have sharp boundaries where the translucency decreases and manifests a white or creamish yellow or brown color. For examples, the abnormalities we described before may be caused by nutritional factors or exanthematous disease like chickenpox, congenital syphilis, or undiagnosed and treated celiac disease, or hypocalcemia, dental fluorosis, birth injury, preterm birth, infection or trauma from a deciduous tooth. All these are considered factors responsible for the abnormalities that may occur in the teeth. In many cases, the enamel defects is caused by celiac disease, and sometimes this is the only manifestation of the disease or the sign or symptom of the disease. May be mistaken with fluorosis of the teeth. Also, the enamel hypoplasia resulting from syphilis is frequently referred to as Hutchinson's teeth. In another type of abnormality, in Turner's hypoplasia, for example, is a portion of missing or diminished enamel on a permanent tooth, usually from a prior infection of a nearby primary tooth. Hypoplasia may occur also as a result of anti-neoplastic medicines or therapy. Destruction that happens after development. The common cause, of course, is dental caries. It's a normal physiologic process, but may become severe enough to become a pathologic condition if left untreated. Attrition, we referred to this before. It's a loss of tooth structure by mechanical forces from opposing teeth. This is called attrition. It initially affects the enamel, and if unchecked or untreated, may proceed to the underlying dentin. The process of abrasion is the loss of tooth structure by mechanical forces from a foreign element. If this force begins at the cement-to-enamel junction, then progression of tooth loss can be rapid, since enamel is very thin at this region. A common source of this type of tooth wear is the excessive force when using the toothbrush, for example. The process of erosion is a loss of tooth structure due to chemical dissolution by acids, not of bacterial origin, and not the ones that work on leftovers of starch and sugars and fructose and glucose in the mouth. Signs of tooth destruction from erosion is a common finding in the mouths of people of bulimia patients. Bulimia patients, they eat and then they induce vomiting by introducing their finger in the throat, and this will expose the teeth to the corrosive action of the gastric acid. Also in people who suckling on lemon juice, sucking lemon juice, there are people with that habit. They love the lemon juice, and that's why the tooth become affected or eroded. Abfraction is the loss of tooth structure from flexural forces. Under pressure, the tooth flex, and the arrangement of teeth touching each other, known as occlusion, causes tension on one side of the tooth and compression on the other side of the tooth. When tooth destruction occurs at the roots of the teeth, the process is referred to as internal resorption when caused by cells within the pulp, or external resorption when caused by cells in the periodontal ligament. Discoloration of teeth may result from bacteria stains, tobacco, tea, coffee, foods with lots of chlorophyll in them, some restorative materials, and medications. Stains from bacteria may cause colors varying from green to black or orange. Green stains also result from foods with chlorophyll abundancy and excessive exposure to copper or nickel. Amalgam, a common dental restorative material, may turn adjacent areas of teeth black or gray. Long-term use of chlorhexidine, a mouthwash, may encourage extrinsic stain formation near the gingiva on the teeth. This is usually easy for the hygienist to remove. Also, systemic disorders can cause tooth discoloration. Congenital erythropoietic porphyria, for example, causes porphyrins to be deposited in the teeth, causing red-brown coloration. Blue discoloration occurs with alkaptonuria and rarely with Parkinson's disease. Erythroblastosis fetalis and biliary atresia may cause the teeth to appear green from the deposition of biliverdin. Also, trauma may change the tooth to pink, yellow, dark gray color. The pink and red discolorations are also associated in patients with lepromatous leprosy. Some medications, such as tetracycline antibiotics, may become incorporated into the structure of the tooth, causing intrinsic staining of the teeth. See different factors responsible for the discoloration of the tooth. And now, when it comes to alteration of eruption, the eruption may be altered by some factors as well. When eruption is prematurely stopped, the tooth is said to be impacted The most common cause of tooth impaction is the lack of space in the mouth for the tooth. Also, other causes may be tumors or cysts or trauma and thickened bone or soft tissue. A case called tooth ankylosis happens when the tooth has already erupted into the mouth, but the cementum or dentin has fused with the alveolar bone. This may cause the person to return their primary teeth instead of having it replaced by a permanent one. The developmental factors may include abnormality in number, like anodontia, a total lack of tooth development, hyperdontia, a presence of higher than normal number of teeth. Hypodontia is the lack of development of one or more teeth. Oligodontia may be applied for those who the absence of 6 or more teeth. Abnormality in size, like microdontia. Micro means small, is a condition where teeth are smaller than the usual size. Macro is big. The teeth are larger than the usual size. Macrodontia. Microdontia of a single tooth is more likely to occur in the maxillary lateral incisor. It's a common site for microdontia. The second most likely tooth to have microdontia is, or the third, molars. Macrodontia of all teeth is known to occur in the pituitary gigantism, or those who take medications for the body buildings, and in pineal hyperplasia. It may also occur on one side of the face in cases of hemifacial hyperplasia. Abnormality in shape, the fusion of two deciduous teeth, called gemination, when a developing tooth incompletely splits into the formation of two teeth. Fusion is the union of two adjacent teeth during development. Concrescence is the fusion of two separate teeth only in their cementum. Accessory cusps are additional cusps on a tooth. A dens invaginatus or dens indente is a deep invagination in a tooth causing the appearance of a tooth within the tooth. Ectopic animal is animal found in an unusual location such as the root of the tooth. Taurodontism is a condition where the body of the tooth and pulp chamber is enlarged. This we see in Klinefelter syndrome, trichodento-osseous syndrome, the XXX syndrome, and XYY syndromes. Hypercementosis is excessive formation of cementum that results from trauma or inflammation, acromegaly, rheumatic fever, Paget's disease of bone. Dilaceration is a bend in the root which may have been caused by trauma to the tooth during formation. Supernumerary roots is the presence of greater number of roots on a tooth than the number expected. Abnormality in structure. Aminogenesis imperfecta is a condition in which animal does not form properly at all or at all. Dentinogenesis imperfecta, a condition which dentin doesn't form properly and is sometimes associated with the generalized disease of osteogenesis imperfecta, where there is abnormal development of bone of the baby, of the fetus. Dentin dysplasia is a disorder in which the roots and pulp of teeth may be affected. Regional odontodysplasia is a disorder affecting the animal dentin and pulp and causes the teeth to appear ghostly in radiographs. mean they become faint. Diastema is a condition in which there is a gap between the two teeth caused by imbalance in the relationship between the jaw and the size of the teeth. Well, this concludes the anatomy of the tooth lectures. I hope you got the maximum benefit from this lecture, and thank you very much for watching.